we're having a night of important topics. It's weird. Sometimes that happens, but thank you for listening on the fracking. And I want to thank Randy for sending me all of those links. She's my friend, a listener who keeps me up to date on fracking news, and I love that. So, as I was saying before the break, this is a topic that is extremely important to me, as I have had this pain condition and gotten through it. This is a really, really great book, and possibly the best one I've read on it so far. The title of the book is The Great Pain Deception. It was honored as a finalist in the 2012 International Book Awards for Best New Health Book and Health Alternative Medicine, which is very cool. And we have the author here right now, Stephen Ray Ozanich. Hi, Steve.
Hi, Janette. How you doing?
I'm good. How are you doing?
I'm doing pretty good. Thanks for the invite to come on and talk about this topic that affects everyone.
It does. I can't. I mean, really, I'm raving about your book. It might be my favorite book that I've read on this subject because of how accessible it is. As you know, I was having a little recurrence of my own condition when I picked up your book, and I'd had it for about 2 weeks. On a Tuesday night, on a Wednesday morning, I realized, I bet that's TMS. I picked up your book. The pain was almost gone by that night.
Isn't it an amazing process?
It's so interesting. A few people have said, "Oh, I'm so sorry." I'm not even sorry. If I find it so fascinating. So why don't we start with the basics? Because I've jumped in right in the middle, and I want my listeners to really know what we're talking about. We're talking about a pain syndrome, for lack of a better word, TMS. Can you give us a little, just as succinct a description as you can of what this condition is?
Sure. That's the brainchild of Dr. John Sarno from NYU Medical Center. As you know, you met him.
Yep.
And it is the cause of almost all of our pains and pretty much all of our health problems. Now, not all of them, but almost all of them. And he found out years ago, maybe 1970s maybe, that the structure of the body was not causing these vast array of pains that the medical doctors were attributing to the pain problems, that there was something else, because what they were doing conventionally was not working.
Right.
And the pain epidemic gets worse every year. The stats show that. And so he began to look for something else, and he found it by talking to his patients. They were all hard-driven, perfectionist, warriors, responsible people. And these great demands that they put on themselves to make everybody happy, keep everything going, is such an enraging thing deep within the consciousness that they actually have to create a diversion in their minds away from these powerful emotions that are about to surface. And it happens to come through the body. So the body is actually expressing itself for what the person can't do verbally. Like back pain is the big thing, and now foot pain, hand pain, skin problems, gastrointestinal problems. All of these things are coming through as an unconscious process, but the medical industry is blaming it on the failing body, and that's actually making the problem worse. Now, we're not talking about accidents, of course,
right,
or blood clot or aneurysm or infection or things like that. Anything like that can happen. We're talking about the run-of-the-mill herniated discs, heel spurs, partial tears in the meniscus, rotator cuff tears, stenosis, all of these innocuous terms, they're part of the human condition. But the brain will actually use those sometimes, Dr. Sarno found out, to try to fortify in the mind of the person that there's something wrong there. But it's not always there. You have a herniation at a certain part, and you have numbness on the other side or something. So
right. So essentially, it's essentially the pain is there. I don't know if this was a quote of Dr. Sarno's that I read in your book or your quote. It's essentially there to distract you from an emotional condition.
Right. That's essentially what Dr. Sarno found out, and I proved true in myself and with hundreds of people that I've worked with. It's been true, but that is a deeply offensive diagnosis to a lot of people.
I know, and I want to get to that because I want to get to your story before we get to that, because it is one sentence you had in there which I thought it actually made me laugh. Throughout history, we've been able to walk around. Our knees have worked, our feet have worked, our spines have worked, and in the past 50 years, our entire skeleton systems seem to be crumbling. That cracked me up.
Isn't that something?
Yeah.
But part of that is the medical advancement. But I don't know if you want to get to my story first.
Yeah, let's tell your story, because this one, one of the reasons why this book, The Great Pain Deception by Stephen Ray Ozanich, is so powerful is because although there's a tremendous amount of research and a tremendous amount of information, you didn't write this as a doctor. You wrote this as someone who has had the condition and has survived the condition. So and this, I mean, all I can say is there were times I had to just set the book down and breathe, just reading what you went through. Your pain started when you were 14.
Yes, right around that time, and out of the blue, like a lot of it. I called that acute phase 1 in my book.
Mm-hmm.
Just nothing, no trigger, no physical incident. My father took me all around, and it just got worse and worse. And then over the years, for almost 30 years, I had done everything, like I remember you saying on with Dr. Sarno. He tried everything. Nothing worked. I was weeks away from discectomy and bone fusion and all that to take care of the back. I'd never had surgery. And a friend of mine said, "Hey, I saw an article. It reminded me of you by a guy named Dr. Sarno." Well, that's pretty much how a lot of people found it, through somebody else. I read it, and it's like, that's me, that's me. But like everybody else, I didn't believe it at first either.
Well, could you just say a little bit about, because it's very profound in the book, some of the struggles that you were going through, and you can, I think in a way, especially for anybody that has some skepticism, when you're reading your story, then you can go, oh, no wonder he needed distraction.
Yeah, and that was towards the end when I was close to surgery, do you mean?
Mm-hmm. Well, I was talking about what happened with your wife.
Yeah, that was towards the end. Now, I struggled decades before that, too, on and off, but it reached a pinnacle where I thought, well, my back's worn out. I'm, 40 years old. It's worn out. I don't know how it wore out that early, but it did.
Right, because you weren't able to walk move around since you were 14, but damn it, it fell apart.
I know, and I am a very physical athlete, a personal trainer. I'm in really good shape. How did this happen? Well, come to find out, it wasn't a physical problem, but as we were having our first baby, the anesthesiologist paralyzed my wife from the waist down with the spinal anesthetic. And, of course, it's a natural state is to repress things like that.
And they had also, it was something that could have been fixed very easily, but the doctors literally left her over a weekend, 70-some hours, and by the time they saw what the mistake had been, it was too late to restore her ability to walk, correct?
Yeah, that was the tragedy. It's not actually when they put the spinal into the spine to deliver the baby by C-section. Yeah. It's not the injection, because a lot of times they hit blood vessels in there, and that's just part of medicine. There's nothing you can do. The malpractice came when they let her lay there, and I was calling her houses and offices, and the nurses were frantic calling them, and they were like, it'll go away. Well, the people at university hospitals, who I eventually took her to get the blood clot removed, they freaked out over that. What could they be thinking? Yeah. But it only happened 25 times in recorded history.
Oh, my God.
I heard that on the stand for the first time when the experts came in to testify. But
so here you are. You've been having, unbeknownst to you, you've had TMS already for decades.
Yeah.
And then you're in a situation with a new baby and your wife dealing with a challenge that no one ever expected to face in this life. And your condition continued to worsen.
Yeah, well, it got worse over a 10-year period.
Yeah.
Because I never purged it from my system. That's the problem. You can't take an event like that, and most people can trace their TMS back to an event, whether it's a mild TMS event or a serious one. Mm-hmm. But you can't take an event like that and go, okay, life happens.
Right.
You cannot. But that's called repression, that Freud talked about a lot. And when you repress it, you actually push it into your body, and it's stored there as a memory. And until you have a catharsis through talking cure or something like that that's very powerful, it's going to stay in there. Well, it stayed in there, and then it looks for an opportunity and waits, it nags you, and then it starts to come out. Well, I was bedridden for a long time,
mm-hmm.
but it's not that unusual. What happened to my wife was, but
yes.
That type of TMS story is not that unusual. I've heard some really horrific stories, but, it started to come out, which he showed as it's rising to consciousness. In other words, your anger over a certain thing. It's rising to awareness where you actually have to deal with it. It's too powerful for you to take. I mean, you could pass out. It could stop your heart. The emotions, he said, are too powerful too sad or too threatening to you. And so, to me, of course, I look back now and say, oh, yeah, of course that was too powerful.
Right.
I would just be crying for months probably, but you can't do that, because of your persona, your superego. It represses things like that.
Because you're a perfectionist.
Yes, and
right.
Of course, superego, we all have one. We all have an ego because we have to deal with other people. Some people have laughed when I talked about it. It's acceptable to have physical problems in our society. You're actually honored a lot of times.
Well, actually, people can be quite proud of their physical problems.
Oh, yeah, they sit around in bars and in golf courses talking about, you think you had a bad mind, and part of that's the storytelling and the camaraderie, which I mentioned in the book, and a lot of it is the system is set up to actually pay and compensate people for it, and so it goes on. The problem goes on and on.
Right. And what I find interesting about TMS that Dr. Sarno had said as well is that you don't necessarily even have to know what you're repressing. You just need to know that you are repressing.
That's a great point that you bring up, because I hit the 400 mark this week. I released the book 7 months ago. I hit the 400 email mark that I have of people telling me, it's the best TMS book out there.
It's great.
Oh, thank you. You saved my life. And it's so rewarding. That's the number one thing people are asking me right there, what you just said, is, do I have to find exact things, Steve? Well, I'm not an expert. I have studied it for 10 years, and I see things, I read everything.
It's an amazingly well-researched book, The Great Pain Deception by Stephen Ray Ozanich, available wherever books are sold.
Yeah, Amazon mostly, but I see all the big distributors have it.
Yeah. This is an extremely important book, extremely important. But so you don't necessarily have to. I mean, I suppose it depends on your on the person. Maybe some people need to get to the root. I've never gotten to the root of it. I just know that it's happening.
Yeah, I think it depends on how debilitated you are. If you remember the story of Helen that Dr. Sarno wrote about, who was bedridden for 2.5 years,
yep.
She was molested by her father.
Wow.
And so she repressed that, and they had to pull that out of her at NYU. The psychologist had to pull that out. Now, sometimes, I don't think the most of us have to do that. And, you just have to, I understood right off the bat, well, that's one of the reasons, because I had it 20 years before.
Right.
But it's just that it's a certain personality that tends to be nice, and that niceness has to be countered with anger. There has to be a countering force. Later on, when you get into the book, at the end, it talks about Carl Jung's work on between thinking and feeling and stuff like that. You can't do two at the same time; they hinder each other. But
right.
Yeah, you don't have to necessarily find it. It's what Dr. Sarno coined that phrase, knowledge therapy.
Yes,
it's about understanding this is what's happening to my back and neck and knees and feet. It's that the brain is diverting you. It's reducing the blood flow there to create a pain so that you have to force your mind onto the body and away from what you're actually thinking about. And once again, it's very offensive to people, but it's unconscious. They don't know that it's happening because it's outside of their awareness. That's one thing they need to know. And Dr. Sofer, who wrote the foreword on the cover, he's a good friend of Dr. Sarno. He's a very brilliant TMS physician.
And it's wonderful that there are TMS physicians now, because whenever I got this in '97, really Dr. Sarno was almost the only person that was treating it. Now, you said that somebody had introduced you to Dr. Sarno's work. Yeah. So you read the book. You thought, maybe that's me. How did you go from a life of agony, having to lay over a ball, not being able to sit up, not being able to walk around, not being able to play golf, being in searing, because TMS can be extremely painful. What did you do once you had accepted that it was TMS?
Yes, and he did say it's the most painful thing he'd ever seen in clinical medicine.
Yeah, it hurts.
Yes, so I was totally flat out. Well, I thought, you know what? I was one of those people scared to death of surgery. I mean, I had seen my wife handicapped with a needle.
Yes.
And I didn't want my back laid open. And plus, I'd never seen it work in anybody that I ever saw. And they'll say it worked, but they can't sit. They always have to wear braces, and they have shoe lifts. It didn't work.
Yeah, because it's not that's the thing. Somebody offered me surgery on my ankles. Well, thank God I didn't have it. There was nothing wrong with my ankles except for tension. This condition.
Right. It's a placebo. If it does work, if you had back surgery and they trimmed a disc or had foot surgery or whatever, the mind is so powerful that the placebo effect actually can heal you. But I healed by looking at his material, and I rejected it at first, but I was scared of surgery. And so I read it and read it and read it, and the more I read it, of course, like everyone else, the more sense it made.
Yeah.
Oh, yeah, I had that. Oh, yeah, I do that. Oh, yeah, I do that all the time. And, well, I was kind of stuck at that point, and until I bought his audio tapes. You probably read that part.
Yes.
Something about, you were fortunate enough to see him. There's something about the personal thing or hearing his voice that connects with people. And when I bought the audio tapes, I just thought, I'm going for it, because it's either a life of misery,
Yes,
which a lot of people choose because they say, no, you're completely right on that TMS thing, man. You're exactly right, but not in me, buddy. I got a bad neck.
Yeah, people, they do not want to let go of their pain.
No, they don't let go.
They don't want to.
Yeah,
and it's fascinating. So I was so impressed as I'm reading this book, and again, I'm going to keep saying the title. It is a really, really great book, The Great Pain Deception. Chronic pain. If you have chronic pain, if it has not gotten better over 3 or 4 weeks, you probably have TMS. Read this book, The Great Pain Deception. Could change your life. Absolutely could change your life. So you know that you've got it. You've accepted it. You're listening to the tapes. You're dragging yourself. You started to run.
Yeah.
With the agony.
Yeah, that was when I was down, and every day I was caught in a loop that a lot of people get caught in, this autonomic nervous system loop. The brain continues to keep reducing the blood flow to certain areas.
By about 5%. It causes no real damage. It causes oxygen deprivation. Oxygen deprivation causes pain. The more you change your life to accommodate the pain, the greater the pain will grow.
Right. Very well said. Very well read. But I was there, and I hit a crossroads, like I said. I hit a pinnacle of low. The room was distorting. I was in so much pain I was going to pass out. I was down about 50 pounds, and I heard the Nike commercial come on TV. It said, "Just do it." And that just resonated through my spine, literally. And I thought, well, yeah. Why would I keep doubting? Because doubt is the thing that keeps people from healing with this. You have to have full belief in the process. And sometimes we have doubt, the pain gets better, comes back, and moves around, But once you have full belief and you understand it deeply, it tends to go away. Depending on emotional things, of course.
Right. But you make such a great point, is that you must believe it. If you don't believe it 150%, you're not going to recover. At one point in your story, you were talking about, because then, as you just said, the pain can start to move because the brain is trying to trick you. You said something that really helped me at one point. You were talking about your TMS, and you said the TMS overplayed its hand.
Yeah.
And it was like, when the pain starts to move, or with me, I thought it was plantar fasciitis, and it moved up my ankle to where it used to be. And I went, aha, then I'm quoting your book, because I'm going, it's overplaying its hand. But at one point, in your recovery, when your pain started to move around, you got pain in your foot and the ball of your foot, and later in the heel. And the way you dealt with this is you went outside and slammed your feet on the ground as hard as you could.
Yeah.
Talk about that. That is awe-inspiring, because that's what it takes to recover.
Yeah, that takes full belief.
Yes, it does.
Something like that. But I was at the point then where the back pain was virtually gone. It would come back a little bit. It was jumping around in my body. That's when you know you have it.
Yeah.
The brain begins to get frantic. It's like, oh, my God, I'm trying to play a joke on this person, actually a ruse, a diversion on this person, and now they're onto me. And so it shifts. He came up with the symptom impaired. It was another brilliant insight of his. But it moved to my feet, and I started to go out. And I hadn't done anything to my feet that hurt them. And the next day, it felt like a big ball or rock in my foot. And I thought, I know exactly what this is. And I started to jog down the driveway, and I slammed it. And I felt tingling in my face because, the slamming of the foot.
Yeah.
And it disappeared. It disappeared because I guess I told the brain, don't do that at some point.
Well, it's that message. The message is so clear to the brain and talk about the thing. I was just reading, because I did skip ahead, and that email you sent me, the part you thought I didn't read. Oh yeah, I did skip ahead and read that chapter. Now what was I saying? Now by telling you that, I forgot what I was talking about. The slapping of the feet, the pushing of the. Oh, well, I'm going to have to go on to another question. It'll come back. That it takes advantage of where there has been an injury in the past, or maybe there's a symbolic connotation. I can't stomach it, or something like that.
Yes, and I used the example of Mark Twain. Remember, he was writing The American Claimant, and his arm started to hurt so bad he couldn't write, so he switched to write with his left hand, and the pain jumped from his right arm to his left arm, so he couldn't write with his left arm either. So I said the symptom impaired has been around for a long time, it looks like.
Uh-huh.
But it's true, it jumps around, because once you're onto it, it has to find somewhere else. And the problem is, and I fell for the same thing too, is people think, now I'm healing and I hurt myself.
Yeah.
Because it's so sly. The brain is so sly. It wants to create a pain almost like a virus that needs the host to live in. It can't kill the host, you know.
Right.
It has to be just enough to think, well, you know, I have been walking on my feet a lot lately, you know, but we are so much stronger. It was Dr. Sofer, by the way, that told me about that, about it finds old injuries. I have to credit him for that. He mentored me through the whole process. But, yes, it will, you know, the old football player and his trick knee, they don't realize it's healed. The body heals within a few months. If you've got a pain, you said it on the intro, I heard, if you got a pain for 20, 30 years, that's an emotional process. The body has healed itself a long time ago.
Yeah, it is the most fascinating condition. Once you understand it, then you don't even mind the working through the pain, because once you completely get it. Now, where are you? You're pain free now, right?
Absolutely. And now, of course, you know, right, if things get really tense, you'll feel something, you go, no, right, and it disappears. When I released the book at the end, 7 months ago, that night before, my back was locking up on me. Well, I knew it.
Oh, yeah.
I am nervous about releasing this because I worked on it for so many years. Well, it disappeared, you know.
Yeah.
The thing is don't pay attention to it. Just go do what you're going to do.
Yeah, because in the book, The Great Pain Deception by Stephen Ray Ozanich, you'll read that if by paying attention to your body, to the pain, you increase it. By ignoring it, you get away from it. I remember what I was going to say. You were talking about some people talk to the pain and yell at it. You don't yell at yours. I yell at mine.
Yeah, and it works, too. And Dr. Sarno saw it worked. And I've also had people email me and say, you know, I was like you, too. I said, you know, all right, take it easy, everything's fine. Nice, gentle talking, I guess. And it brings the anxiety down. But I've never seen two people heal in the same way. That's why it's such a syndrome.
Right. And you also have the entire medical community. Can you explain how the conventional approach to doctor's pain is keeping us all in pain?
Yes, because the brain's intent, whether it's gastrointestinal problems, frequent urination, digestion, skin problems, pain problems, it's all the brain's same strategy. The brain's intent is to keep you thinking that you have a physical problem that needs attended to because, as we said earlier, to divert your mind's eye from something that you do not want to think about. Okay, or you can't think about it, or you don't even know exists.
The brain thinks it's doing you a favor.
Yeah, it's Dr. Sarno's other brilliant observation. It's doing you a favor, and it is. It chooses physical pain over anxiety for some reason, and I guess I understand because anxiety is worse, I think, at some point. But if the modern medical industry focuses on the body, that's what the brain wants.
Right.
And so you go back year after year for adjustments to your spine and injections and 3 and 4 surgeries. I ran into someone that had 10 back surgeries.
Oh, my God.
And they had this personality, the type T that I talk about. Yes. And I showed him the book. He said, yeah, that's kind of like me, but I got a bad back. He was never going to buy into it.
Isn't that fascinating?
It's sad and fascinating.
And how many people just refuse? They believe you had it. They see you recover from it, and they just cannot accept it for themselves.
Right. And Dr. Sofer said to me, yeah, my patients, they look horrified at me when I tell them, you're not as unique as you think you are. You have this syndrome. Well, they think they're the exception with the physical problem.
Right.
Now, you could, of course, you know, and there's no absolutes in this world. You could have some weird thing there, but I mentioned in my book about Dr. Weil's patient, Andrew Weil.
Yep.
The guy had multiple herniated discs, and one of them was fragmented into multiple pieces. And he said the guy was in so much pain he couldn't even understand him. So he got him to go to see Dr. Sarno, and his pain went away.
Yeah.
It's that easy, you know. But you could have something there, so you have to get, you know, you could have a tumor or something.
Well, you do have to go to the doctor because your brain won't let go of it otherwise.
Right. The problem is the doctor can fortify the problem by saying, here it is right there. You see that disc herniated right there? That could be the problem, you know. And Dr. Sarno identified that it's the objective numbness that you should be looking for.
Well, you had also gone through this yourself in your 20 years of pain going, but I saw the X-ray.
Yeah, that was the hardest thing to get out of your mind is once you see the modern technology, the imaging, all of a sudden your healing is set back many, many years. And I had to get that out of my head, so I used guided imagery by visualizing perfect openings and big, wide foramina and discs that were real cushy, and it begins to work. The pain begins to go away because when they tell you something's wrong, and Dr. Sarno clearly identified this in all of his books, when the doctor tells the patient something's wrong, their bodies lock up in rigidity, and sometimes they have to carry them around. They can't get it out of their head. It freaks people out. It causes the tension to rise. when we're told something's wrong with our bodies.
Right, because the conventional method, because I thought I had plantar fasciitis, and they say, well, stay off it. If it hurts, don't walk. And what you have to do with when you realize you have TMS is walk and ignore it. And so there's a fear, which is why the timing, you had sent me your book and it had stayed on my pile because, as I told you, I like to read all of the books before I put them on. But The Great Pain Deception by Stephen Ray Ozanich, and it was, I don't think I could have gotten through this, even having been through it once in my life. I don't think I could have gotten through it as quickly without reading your book, because I was sitting at the doctor's office. He told me it was in my left foot. He said, you have plantar fasciitis. Sitting there, my right foot began to hurt.
Isn't that something?
Yeah, and it was exactly what you're talking about in this book. Now, another thing, and there is so much. I'm telling you, this is an exceptional book. It's got you quote the other doctors when you need to, but the research is amazing in this, and the fact that you lived through it. You didn't discover it. You lived through it, and you may have seen more extreme cases, but when I read this, I hurt for you. I thought it's a remarkable accomplishment and a remarkable book, The Great Pain Deception. It should be in everybody's library. Stephen Ray Ozanich. Now, you were talking throughout this book in different places that other conditions that are similar to TMS.
Equivalence, do you mean?
Yeah, that's what I meant.
Yeah, the equivalence. Pain is just one thing that the brain can use.
Mm-hmm.
Dr. Andrea Siegel, who co-authored The Divided Mind with Dr. Sarno, she talked about the bowel movements and the urination and dry eye. She's become legendary about that because the brain will actually dry the eyes up to make you think about it. And while I was writing the book, I would get that sometimes, and I would be blinking. And I realized, oh, my God, I'm writing about it, and I'm actually getting it because it made me focus on my eyes. And she said to her one patient, "Can you cry?" And he said, "Yeah." She goes, "Well, then you can produce tears. So it must be the brain," and the guy healed.
Wow.
It's amazing.
Well, the problem with TMS is that there's no money in it because you don't need a drug. You don't need to be in physical therapy I was once in physical therapy for over 2 years, twice a week, trying to get these freaking ankles fixed when there was nothing wrong with them. So I think it's difficult because it's not a moneymaker.
I remember watching you on that 2020 episode, and you were talking about how much money you had spent on it. I started immediately calculating from 30 years about how much I had spent. Of course, my dad spent a good bundle of it.
Right, and then insurance, but still.
Right, yeah, it's out of here. And, there's one reason, like Dr. Sarno has said, they look at it, success rate's in the 90th percentile for the people who actually try. And he said, they just walk away.
Yeah.
They can't deny it because it's true.
Right.
But surgery, therapy, drugs, and injections are the cash cows.
Absolutely. If you're willing to and able to open your mind and to educate yourself, you would be amazed. You may very well be able to cure yourself by reading a book. And because I've talked to many people who have read, who by learning about it without even going to a doctor, have really had amazing success. And again, I just read The Great Pain Deception the morning when I started doing it, from just above my ankle bones down, both feet burning like fire. By the end of that day, just about taken care of. You have some really interesting concepts. It's really, this is a book. This is a book. You're talking about TMS and aging, and I thought this was fascinating.
Yeah, that's the biggie.
Yeah.
I call it the not so happy birthday trigger. It's true. I've rushed relatives to the hospital who turned 70. I worked with a guy from Massachusetts. The night he turned 70, he was crippled. There's something enraging about our mortality.
Well, I personally am livid that I'm going to have to die. I don't want to die ever, ever, ever. And a lot of what you talk about in The Great Pain Deception is this anger and this separation. And when I read that, it's like, why is everybody at a certain age in pain? Well, we're mad. We see the end coming.
Yes, I remember my 20th birthday I was in pain, my 30th birthday I was in pain, and my 40th birthday. And when I turned to 50, I had already written the book, and it was a breeze, went right through it.
Yeah, see? That's amazing. And also, now this one was a surprise that you were equating arthritis pain. Do you think that some arthritis pain is TMS?
Right, some. Now, there are some that are horrifically painful, like the gout or rheumatoid arthritis and so on. Although, I use an example of Dr. Don Colbert from Florida in his book Deadly Emotions. He talked about this woman who developed rheumatoid arthritis because of her anger at her husband, and she couldn't let it go until it eventually killed her.
Wow.
Towards the end, the letting go chapter towards the end of the book.
Uh-huh.
I think, and one of the better books I read was by Dr. Simonton. He was a world-famous cancer physician. In his book, he made it clear that powerful emotions can cause things as serious as cancer, too.
Well, that's another great thing about this book, The Great Pain Deception, is the resources that you get from it. Because you mention a lot of authors and a lot of books, and you say in one section, read another book. When you're finished reading this one, read a different one, and just keep reading them.
Yes.
And there are not enough books out there about this condition, and certainly not enough books by people who aren't doctors. That's what I love so much about your book.
Yes.
It makes it more accessible to me. You were also talking about TMS and eating disorders.
Yeah, a good example I put in my Appendix A at the end of the book.
Yep.
Bob Greene, who's Oprah Winfrey's personal trainer, he said in his book that, every time she got high levels of tension or stressed out, she would head for the refrigerator, and eat. And we know food is a calming source for us. And think about it. The brain's distracting you. I'm thinking about food. I'm thinking about food. If it's not a back pain, it's that. Well, he said, once I got her to stop doing that, she started developing back pain, migraines, and spasms all over.
Wow.
That's how the symptom imperative works. As human beings who are anxious by nature, or existential part of being a person is anxiety, I suppose. And we have to learn how to control that as part of probably our growing in our lives.
Yeah.
We focus our mind on something, and that's why I keep saying towards the end of the book becomes more philosophical about life.
Yes.
It talks about having a purpose in life and a direction, and focus and obsess on something good, and the pain goes away.
The pain and the eating. I forgot until I read it in your book that when I sat in Dr. Sarno's lecture, which is what he did for treatment those years ago, I did feel like he was saying, because I've always been overweight, I felt like he was saying more about weight loss than I'd ever heard anybody else say in a way that applied, and I forgot until I read your book, which is, I can't tell you how great it is. I can't thank you enough for your patience and waiting for me to read it, and I can't thank you enough for fixing my feet.
That was so nice of you, and I thank you for remembering me after we communicated a long time ago.
I did. Well, you sent me the books, and I get a pile, and I do them in order, and this is, so that's what took so long. I really want to thank you for being on the show, Stephen Ray Ozanich. The book is The Great Pain Deception. Faulty medical advice is making us worse. It's one of the best resources on this that I've read anywhere. Unless you are screamingly healthy, you need this book.
Yeah, it's universal, like Dr. Sarno said. Yeah. It's a universal condition. We all have anxiety, depression symptoms. Yeah, exactly.
But we can all. But you and I are both examples that we don't have to. Just because we happen to create this in our bodies doesn't mean we have to live with it. I could talk to you for literally for another hour, but I'm going to be in trouble because we have two more commercial breaks.
Call me later.
I'm going to be emailing you later. I really can't thank you enough.
I enjoyed it. You're the best host because you actually read the book. Most of them don't do it, and you actually.
Well, that's what took me so darn long, so that I could do it. But let's keep in touch, and I will continue to. I spent an hour on this 2 weeks ago on a Friday talking about your book and the topic.
You?
Yeah,
Good.
and so I'll keep promoting the book, and we'll stay in touch. I think this is really important.
Thank you. And when you finish it, maybe I can come back sometime and we can continue. That would be fun.
You know what? I'm going to say yes to that.
All right. Well,
okay. We'll see you later.
Okay, Janette. Thanks.
Okay, bye-bye. We'll be back.